Dr. Ezra Amsterdam, Distinguished Professor of Internal Medicine, Associate Chief of Cardiology for Academic Affairs, and Master Clinician Educator at the University of California, Davis School of Medicine. It's a pleasure to be speaking to you today about the new guideline of the American Heart Association and American College of Cardiology for the management of patients with non-ST elevation acute coronary syndrome, a frequent and serious condition. This document is representative of the policies of the AHA and ACC to maintain up-to-date guidelines to support clinicians in their goal of optimal patient management. And it is the result of the combined efforts of almost 20 experts in the fields related to acute coronary syndrome, such as cardiology, cardiac surgery, internal medicine, emergency medicine, pharmacology, and others related to this disease. Several aspects of the document are especially worthy of note. It's the first full revision of the guideline since the 2007 iteration. Revision of the previous nomenclature, unstable angina and non-ST elevation MI, to non-ST elevation acute coronary syndrome reflects contemporary understanding of the continuum between unstable angina and non-ST elevation myocardial infarction. We have also changed the term initial conservative management to ischemia-guided therapy to more clearly emphasize the clinical and pathophysiologic rationale of treatment to these syndromes. In addition, while it has been established that high-risk patients benefit from initial invasive therapy, it's now appreciated that low and intermediate risk patients can benefit substantially from guideline-directed medical therapy, which has not always been optimally applied. And advances in non-invasive testing have improved our ability to identify these low and intermediate risk patients. This guideline recognizes emerging clinical areas and patient populations where further research is required. This important matter comprises situations such as triple therapy with potent antithrombotic and anticoagulant agents. Also, the truly high-sensitivity cardiac troponins should be available in the near future in this country, and the most practical and efficient manner of their application will require study. The approach to over a dozen so-called special populations, including the elderly and women, as well as others with challenging clinical comorbidities, are also addressed. The hospital phase of non-ST elevation acute coronary syndrome entails crisis management, but comprehensive treatment after successful outcome of this phase requires consideration of the post-hospital phase to reduce risk of recurrent cardiac events. To this end, the guideline addresses patient education, maintenance of optimal medical therapy, treatment of cardiac risk factors, and referral to cardiac rehabilitation. Our goal in this document is to provide a focused, succinct approach to optimal patient management that is user-friendly, with referral to, but not repetition of, other guidelines. As always, it is emphasized that a guideline is an aid and does not replace the physician's clinical judgment in the management of individual patients. Finally, we note that the science of medicine is founded on evidence, and the art of medicine is based on optimal application of that evidence to the individual patient.